It's a difficult day for Freemasons volunteer drivers who are doing their last cancer patient pickups. That's because the service has been halted over the COVID-19 outbreak.
We don't want to risk getting clients with the disease or getting our drivers with the disease. So we've decided for the first time in our history to actually pause the program in the interests of safety.
The program in Metro Vancouver has volunteers pick up and drop off patients here at the BC Cancer Centre in Vancouver. Those who run the program say they've had to make the hard decision to stop the service, at least for now, to protect both its senior drivers and the patients. Both groups are considered vulnerable.
We have to factor in the age of our drivers, which is a really important factor because they're all seniors. We have to factor in what's the possibility of either us transmitting it to the clients or for the clients transmitting it to one of our drivers.
Freemasons volunteer drivers.
The program, which typically runs dozens of trips daily, won't be running any after Friday. It's heartbreaking news for users of the service.
No! Oh, that's horrible, really?
Hannah Daber is now cancer-free and no longer needs the service on a regular basis.
I had to endure 6 months worth of chemotherapy as well. Half of my jaw was removed.
She knows from experience how daunting it is to plan daily hospital trips when you're undergoing treatment.
Buses, public transit, it just really isn't an option when you have a compromised immune system like chemotherapy patients do. And the Freemason service was so much nicer than a taxi.
The chair of the program says he's had to break the difficult news to dozens of passengers.
And it has been a very tough decision because we're really concerned about the clients being able to get to their treatments.
The Freemasons program is set to be back up and running early April, but that could change if the outbreak gets worse. While there are a few other similar programs in the Lower Mainland, volunteers know this shutdown will reduce transportation options for cancer patients. In Vancouver, Isabel Regem, City News.